Hello, in this video I'm going to be talking about 10 foods you should avoid during chemotherapy. You'll notice a lot of foods are not on here, and I'll point those out as we go through. Before I go on, I'd love to invite you to subscribe to our YouTube channel. We put new content out several times a week. Also, you can go to yerbba.com and get your personalized report. The first food I'd like to talk about is grapefruit, and that includes grapefruit juice as well. Grapefruit has an enzyme in it that can interfere with the metabolism of many commonly used drugs. I'm not going to list all of those drugs right here, but this is something you can ask your pharmacist about, or you can just avoid grapefruit and grapefruit juice during your treatment. If this is a particular fondness of yours, it can be really hard to avoid it, but it's good to know that this is one of the 10 foods you should avoid. The next food that I'd like to talk about is raw meat and fish. Raw meat and fish, which we often have in sushi or carpaccio, some of the really yummy dishes if you happen to be a meat eater. These can have bacteria and other things in them that you need to avoid during chemotherapy when your immune system is not in tip-top shape. There aren't a lot of foods to avoid, but raw meat and raw fish are the second food to avoid. The third food to avoid is unwashed fruits and vegetables. If you like to pick fruits and vegetables right in the field, or people bring things over to you, we would recommend that you wash them before you eat them. Fruits and vegetables can have organisms on them, not just bacteria, but viruses and parasites that you'll want to make sure you get rid of before you eat. A normal immune system can tolerate a certain dose of these sorts of things, but when you are on chemotherapy, if your immune system is suppressed, you may not be able to fight these little critters off as well as you can when you're done with chemotherapy or before chemotherapy. The next thing I'm going to talk about is the food to avoid is actually a couple types of beverages. So the two types of beverages you'll want to avoid or take in extreme moderation are caffeinated beverages and alcohol. Caffeinated beverages can really make it hard for you to sleep. They can make you more anxious. Now, if you need a cup of coffee or a cup of tea, or you have a particular caffeinated soda that you like to have in the morning, that's very well and good. But drinking caffeine throughout the day after about your lunchtime, whatever that is in your life, can actually interfere with sleep. Even if the effects that make you feel more alert, even if the alerting effects are gone, it can make it hard for you to sleep. And chemotherapy can make it hard for people to sleep because of a whole host of things, including the steroids people get to prevent really severe side effects. But like all things, corticosteroids have side effects, and one of them is insomnia, and caffeine can make that worse. In the case of alcohol, alcohol during chemotherapy and really any time can irritate your liver. And if you're drinking enough to irritate your liver, your blood tests will show that you actually can't have chemotherapy, and that can be really upsetting for you. It also may lead to additional tests like scans to make sure that you don't have cancer in your liver. Avoiding alcohol, even for a week or two, your liver enzymes can come back down to normal, which allows your chemotherapy to go on as usual. And there's some other problems with alcohol as well. We do have a video about alcohol and breast cancer that I would encourage you to watch. The next thing to avoid is unpasteurized dairy, including cheese. Unpasteurized cheese, in particular soft cheeses like brie or camembert or goat cheese, those can have organisms, bacteria, that your body may not be able to fight off. Just like with raw fish and raw meat, we do recommend that you avoid unpasteurized dairy products. I'll just make a little aside here. Pasteurized dairy products are absolutely fine. It's the unpasteurized foods that we're recommending you avoid. Next thing I'm going to turn to are a couple specific supplements. We do recommend that you avoid antioxidants in supplements. Antioxidants in food are just fine. So if you like fruits and vegetables that have vitamin C, if you're on vitamin B because you cannot absorb vitamin D, you have something called pernicious anemia, what a colorful name, you are on vitamin B to live, and you need to take the vitamin B. But in general, we recommend avoiding antioxidants during chemotherapy because it appears to undo some of the effects of chemotherapy. Antioxidants in food are absolutely fine. And then we recommend you avoid garlic as well. Garlic is a blood thinner, and that's good for your heart, but when you're undergoing chemotherapy, if your platelets, which is a type of blood cell, are low, and that increases your risk of bleeding, you want to avoid garlic. Another herb to avoid is St. John's wort. St. John's wort is used for improving your mood, and some people take it for other reasons as well. So just to summarize, I covered some supplements and some herbs. The supplements to avoid are antioxidants in general. The supplements, food is fine. We recommend that you avoid garlic. We recommend you avoid St. John's wort. Okay, we're down to the last three. The next category of foods that we recommend you avoid are processed foods. Processed foods have a lot of chemicals in them. They often have a lot of things we can't even pronounce. Processed foods can fill us up, and that can be one good thing about it, but they can fill us up so much we don't have room for the healthy foods. So processed foods are associated with, believe it or not, depression and weight gain, and we want to avoid those things in general. If you have an eating disorder, please take all this advice with a grain of salt, especially anything regarding what I say about weight. We don't want to activate or cause distress for people with disordered eating. So processed foods we recommend you avoid really in general, but during chemotherapy it's a good time to avoid them. We recommend avoiding sugary foods for a similar reason. Sugary foods can actually increase anxiety, make it hard for people to sleep, make it hard for you to focus, and fill you up in ways that don't allow you to have room for healthier foods like fruits and vegetables and all the things we talked about in our video on things to eat during chemotherapy. And then finally, the last thing is deli meats. Deli meats where there's a big piece of meat and they cut it off for you and you take it home. Because deli meats in some stores are out for many hours, they can get contaminated, which is fine if you're not going through chemotherapy or otherwise immune suppressed. But because of that risk of contamination, we do recommend you avoid those during chemotherapy when your immune system can be suppressed. Packaged processed meats where they're sealed and there's a date on them are most likely very safe. I've covered a lot. I've covered 10 foods to avoid. I want you to notice we didn't talk about avoiding foods containing soy, and we didn't talk about avoiding foods containing dairy. A lot of you have written in with questions about soy in the diet and also dairy. I hope this video has been helpful to you. If it has, click like. That helps other people with the exact same questions find the video. Subscribing will help our other videos show up in your feed. Don't forget you can go to yerbba.com to get your personalized report. Drop a comment or question below about your experience or anything you want to share with the Yerbba community. And as always, thank you for watching.